Hi everyone, welcome back to Nursing Made Kind of Easy. My name is Navi and today I have a really cool video idea for you guys. Today we'll be going over an NCLEX style case study in which you will be able to answer questions live as we go through the case study. Make sure you use your Nursing Made Kind of Easy pharmacology flashcards and fundamental flashcards so that you can get a better understanding of what is going on in this case study. And if you haven't bought them already, what are you doing? Go down to nursingmadekindaeasy.com and use code CASESTUDY for 10% off your first purchase. Everything on my website is to help you become a better nurse and hopefully pass your NCLEX. But you gotta buy it to find out, you know what I mean? Now let's get started with the case study. Today we have a 22-year-old female who presents to the ED with a chief complaint of a fever and a purple rash. Patient reports a fever of 102 degrees Fahrenheit for the past 24 hours. Patient reports an onset of a purple blotchy rash initially appearing on the extremities and is now spreading to the torso and the face. The rash is non-blanching. The patient reports no significant past medical history, no recent travel, insect bites, or known exposures, no history of allergies, chronic illness, or recent vaccination. The patient appears febrile and mildly distressed. Temperature is 102, heart rate is 110, BP 120, over 80, respirations 18, SpO2 98 on room air, and there's no signs of significant respiratory distress. So now that we have a little bit of background information on our patient, we're going to move on to question number 1. Which of the following actions should the nurse take first? A. Request orders for additional labs and testing. B. Administer antiviral medication. C. Retake vital signs. Or D. Raise the head of bed. You guys can go ahead and pause the video if you need more time, but the correct answer is A. Request orders for additional labs and testing. We would want additional testing to figure out what is causing the fever and the rash and hopefully get closer to a diagnosis. We wouldn't want to administer an antiviral medication since we don't know what pathogen is invading her body. We wouldn't retake vital signs because all her vital signs are normal except her temperature. However, her temperature matches up with what she has reported for the past 24 hours. We would not raise the head of bed because the patient shows no signs of respiratory distress, her O2 is normal, her respirations are normal, and they're even and unlabored. Okay guys, great job with that first question. Now that we put in our request for additional labs and testing, we're gonna go check them out and see what they look like. We have a CSF analysis that has came back cloudy and purulent. The CSF protein is 400. The CSF glucose is 40 milligrams per deciliter and is gram positive. Our blood culture has come back positive for Neisseria meningitidis. The WBCs are 12,000. Hematocrit is 36%. Hemoglobin is 12. And platelet count is 125,000. Now, taking in consideration our new lab results and our initial assessment, we're going to move on to question number 2. After reviewing the lab work along with the presenting signs and symptoms, the nurse should recognize that the patient has which of the following disease processes? A. Viral meningitis. B. Bacterial meningitis. C. Neisseria. Or D. Pneumonia. Now, I really want you to use your nursing caps, okay? Put on your nursing caps right now, okay? Y'all that I meant figuratively? No, I mean literally. Literally go buy your nursing cap today at nursingmadekindofeasy.com and use code DEPRESSEDNursingStudent for 10% off so you can look fresh and fun like me. Now, let's get on to the video. The correct answer is B, bacterial meningitis. So it's not viral meningitis because Neisseria meningitidis is a gram-positive bacteria. Also, the cloudy and purulent CSF is indicative of a bacteria and not a virus. It's not Neisseria. I made that up. Just to trick you guys. Hopefully it worked. Probably didn't, but it's okay. D, it's not pneumonia because usually the causative organism of pneumonia is Streptococcus pneumoniae. But if you got that right, give yourself a round of applause. Good job, guys. We have some more information. Looks like we have some providers' orders. We have acetaminophen 500 milligrams by mouth every 6 hours for a temp above 100.4, and we have ceftriaxone 1 gram every 12 hours IV over 30 minutes. Buckle up, everybody, because we got a change in condition. Let's go see what's going on with our patient. Our patient is having difficulty breathing and has become increasingly confused. Heart rate is 110, BP 90/60, respirations 22, O2 90%, and temp 102.4. Our patient appears flushed with pallor present. Patient is difficult to rouse with positive Brudzinski sign. No peripheral edema, radial and pedal pulse is weak, but palpable bilaterally, using accessory muscles upon inspiration. Lung sounds are clear to auscultation, chest rise and fall symmetric with no cyanosis present, and abdomen is soft and non-tender. Okay, so now that we've had our changing condition and kind of know what's going on with our patient, we're going to move on to question number 4. Which of the following intervention should the nurse take? Select all and apply. Initiate oxygen 2 liters via nasal cannula, start IV access, administer IV fluids, administer acetaminophen, administer ceftriaxone, request orders for CT and MRI, or encourage patient to ambulate. Go ahead and pause. This might take some time, but I believe in you, okay? Okay, so the correct answers are initiate O2 2 liters via nasal cannula. Our patient's O2 is dropping, so we need to bring it back up. We need to start IV access and administer IV fluids, again, because the BP is dropping, and we gotta bring that back up. Administer acetaminophen because her temperature is 102.4 and our order is for anything above 100.4. Administer ceftriaxone since we have a provider's order and we know she's having a bacterial infection, we might as well start it now. Request order for CT and MRI because bacterial meningitis affects the meninges of the brain, so we need to make sure nothing's going on in the brain or that the infection hasn't traveled to another part of her body.
Oh my God, bro. Oh, hell no, man.
Okay, so now we're going to fast forward in time. Our patient has been recovering in the hospital for about a week now, and we have new labs and tests to see. Our CSF analysis appearance is now cloudy. The glucose is 70 milligrams per deciliter. The protein is at 100 milligrams per deciliter. The blood culture has come back negative for Neisseria meningitidis. The WBC is at 10,000. Hemoglobin is at 16. And the platelets are at 150,000. The final question of this case study is, which of the following statements made by the patient indicates an understanding of antibiotic therapy? A, I will stop taking the antibiotics when I feel the symptoms starting to subside. B, I will finish the whole course of therapy as prescribed. C, I will take antibiotics for the rest of my life. Or D, if I have any GI problems, I will contact my provider immediately. If you need more time, go ahead and pause the video. But the correct answer is B, I will finish the whole course of therapy as prescribed. You do not stop taking antibiotics. You have to finish the whole therapy, otherwise the bacteria will come back and it will become resistant to the antibiotic that was prescribed. This patient does not need to take antibiotics for the rest of her life, only as prescribed by her doctor, which would probably be a week, a month, whatever the doctor seems fit. She will probably have GI problems, but that is nothing that is immediate or serious. It's a common side effect of many antibiotics, so that's not really a major concern. But congratulations, guys, you made it through this case study and our patient can finally be discharged. She's gonna live a long, happy life because you guys were such great nurses today. If you want more content like this, go ahead and follow me on my Instagram or my TikTok at Nursing Made Kinda Easy, and I'll see you guys next week.